Welcome, everyone. This is Aarti Prabhakar. I'm President Biden's Chief Advisor on Science and Technology. I'm the Director of the White House Office of Science and Technology Policy as well. And I'm just delighted to welcome you to this really important session on a topic that I think is going to matter to all Americans as we get this work rolled out. I want to start by thanking our colleagues at OIRA and the Council of Economic Advisors for their partnership. It's been a terrific working relationship with the OSTP folks. We have some amazing panelists here for this session as well. Thank you for joining us. And it's great to have this broad participation. I'm just going to make a few opening remarks and then hand it over to my colleagues. I want to start by noting that it was his very first week in office when President Biden made it clear how important it is to root policy decisions in data. That was his memo on evidence-based policymaking that went out right at the get-go. And the work we're doing today and announcing today is very much in line with that. We're announcing a new report. It's advancing the frontiers of benefit cost analysis. And, you know, if you step back and think about it, governments have been trying since the beginning of time to do the right thing for people. This is a forever enterprise. And, you know, it started in a modest place because, you know, people used intuition or guesses or personal experience as the guide. And of course, in recent decades, we've made some really important progress as benefit cost analysis supported by real data has become a more and more important part of policymaking. Of course, it's helped in so many ways. But of course, we also understand that it's not perfect because the tools and the data and the methods that we have weren't perfect. Obviously, it's easier to measure the wealth of the wealthy than the health of the poor. And that kind of disparity gets reflected and amplified because of the lack of perfection in our capabilities. So this is a journey, and we're now in a place where we can make some really important progress. And that's what this report is about. It's about filling in some of those gaps in data and methods. Just a couple of examples that really struck me. Right now, if you live in a home that's destroyed by a hurricane, the accounting that we do accounts for the damages to your home. But if your home is destroyed, you're probably not going to work. You may not have access to healthcare and food. And it turns out that after a natural disaster, government pays more for unemployment insurance and medical payments than for direct disaster aid, but that's not really being captured. So with better cost benefit data and tools, we can get better at planning for and understanding the costs that are associated with these impacts. As our climate continues to change, of course, measuring and preparing for these kinds of impacts is becoming more and more important. So it's a good time to get better at this. A different example, we know a lot about how exposures to air pollution and chemicals and pesticides can cause early deaths. But if you think about, for example, a farm worker in California who's facing consistent low-level exposures to pesticides, that it might not kill them, but it could certainly deteriorate their health. And as we develop better analysis methods that show us how people respond to lower doses of exposure, that's going to help us design policies to keep people safe. And for example, by preventing the products that contain these pesticides or limiting how much factories can pollute. So these are some important examples. There are so many others. It's been great to see the research community step up, and many of you here are part of making the advances that I think we're now in a position to take action with, and with the opportunities that are laid out in this report. So with that, let me turn it over to my colleague, Administrator Ricky Revesz from the Office of Information and Regulatory Affairs. Thanks so much.
Thank you so much, Director Prabhakar, and welcome everyone to this roundtable event. I'm very grateful also to my colleagues, all my colleagues at the Office of Science and Technology Policy and the Council of Economic Advisors. So I'm the administrator of the Office of Information and Regulatory Affairs, known as OIRA by its acronym, which is the component of the Executive Office of the President charged with coordinating the review and analysis of significant federal regulations. I see firsthand and every day the importance of high-quality benefit cost analysis to promoting good regulatory practice. Strong benefit cost analysis helps agencies craft better regulations, which in turn means lower costs for consumers, cleaner water and air, less fraud and exploitation, increased worker safety, more innovation, and a stronger economy. And that is why I'm so excited by the Frontiers of Benefit Cost Analysis initiative. Frontiers provides a unique institution for ongoing improvements to regulatory analysis. This initiative works in two main ways. First, it provides a novel and robust whole-of-government approach to identifying key challenges to good analysis and then addressing those challenges. Throughout this last year, the subcommittee on the Frontiers of Benefit Cost Analysis has conferred on which costs and benefits are likely to have significant effects on public well-being, which are relevant to analyses of many upcoming agency actions, and which have the potential for expanded quantification and monetization. The result of that government-wide discussion is the inaugural report that we're here to discuss today, which identifies areas where further quantification and monetization of effects could substantially improve regulatory analysis. This leads to the second major element of the Frontiers initiative, inviting the broader research community to help us make progress on the identified areas. The report provides a clear signal to researchers and academics about where they can be most effective in helping quantify and monetize important but previously unquantified and unmonetized effects. Monetization is achievable in key areas if the broader research community focuses on a common set of challenges, works to fill in key data gaps, update inputs, and expands methodologies. In giving many talks this year to universities around the country, I've been struck by how many academics want to do policy relevant research, but aren't sure how to connect to the policy making community. And this initiative helps make those connections. And so for the broader research community, including academia, nonprofit organizations, stakeholders, communities, companies, and foundations, I hope the report encourages truly policy relevant work. The roundtable event and inaugural report are just the start of the Frontiers initiative. The initiative will continue to provide a robust platform for uncovering important areas where agencies can improve analysis, and subsequent reports can highlight progress made in those areas. I envision a future for the initiative that establishes a cadence. Every year, we focus on improvements in areas suggested by past reports and also put new areas into play. This cadence will help to provide clear goals for the broader research community and lift up important issues faced by agencies. I look forward to seeing how this initiative can continue to improve regulatory analysis in the years to come. And now, to turn things over to my colleague, Dr. Jackson, a member of the Council of Economic Advisors. Thank you so much.
Hi, I'm delighted to be here to speak on this important event, and I want to thank colleagues over at OSTP and also OIRA for helping put this event together with CEA. So, at its core, economics is about how one makes decisions under constraints. And when we make decisions as individuals or group or organizations under constraints, we have to consider how getting more of one thing that we like necessarily implies getting less of something else which we may value. So that's sort of cost and a benefit. So when constraints bind, optimal decision-making, as economists conceive it, really involves weighing the cost of an action against its benefit. So as an academic who does policy-facing work, who now works with the federal government, I'm delighted that this report highlights the importance of continued partnership between academic researchers and federal policymakers to advance regulatory analysis and to make sure that decisions are informed by the best cost-benefit approaches possible. Ideally, these two groups would be in frequent contact so that the research community can be responsive to the specific needs of policymakers, but also so that policymakers can incorporate the insights from cutting-edge research in decision-making. So I'm very excited to hear what everyone here on the panels later on have to say and what connections can be made. So while there's a lot of things that I like about the report, I want to highlight one area that excites me particularly. So in my research, which I had before coming here, I focused a lot on the economics of education. And in that body of research, test scores are the main measure of success in many data sets. And a few questions that I've written on would be, how do you attach value to, say, a 1 or 2 point increase in test scores? And are test scores even the best way to measure impact? So one of the ways that we can address some of these issues, or perhaps just sidestep them entirely, is to have data on long-run outcomes. So in principle, if we had data that was able to follow individuals over time, we could evaluate the effects of interventions or policies on long-run outcomes and get a more complete measure of the costs and the benefits. So in a lot of the work that I've done, I've shown that oftentimes the long-run effects of an intervention or program, such as Head Start or attending a better school, could be very different from what you might expect based on the short-run test score impacts. So for example, I've shown in research that the schools that are best at reducing the likelihood that individuals will subsequently be arrested are not actually those that improve test scores the most. And to give an even more salient example of this, there's a recent study that looked at what happened when individuals were randomly assigned to pre-K in Boston, looking at the universal pre-K there. And what they found was there was no test score effect when you look at test scores in kindergarten and first grade. But by linking data to individuals over time, they found that the individuals who were randomly assigned to the pre-K program were more likely to graduate high school and less likely to be involved incarcerated. So these are long-run effects that we detected that you just would not have detected otherwise. So this highlights an example of where looking at the things in the long run really may change our understanding of the benefits of a program or also the costs. So this subcommittee report highlights this is a key area for growth, which is that administrative data are not always collected with long-term program evaluation in mind. So I'm very excited about this particular aspect of the report. In my work at the CEA, I've also had to do some work related to cost-benefit analysis. So one particular area of interest is gun safety. As we all know, gun violence prevention is a top priority for this administration. And trying to craft policy solutions requires that we know both the costs and the benefits of any proposed solution. And now on this topic, a lot of questions come around like, how would gun owner behavior change in response to incentives or protective solutions? But without detailed data on gun ownership, the use of gun storage, and detailed incident reports, designing well-targeted policy becomes a challenge. Also, there's a broader question of what the costs are associated with gun violence, aside from just those associated with loss of life. And recent research has made some inroads in this regard, using measures such as prescriptions for anxiety medications to measure impacts on community mental health, but there's a lot more that we could do. So tackling these kinds of questions is exactly what this report gets to, and the improvements that can be made in how we craft and target policies cannot be overstated. So I'm excited about this initiative to enhance the partnership between research and federal regulatory analysis, and I'm excited to hear some of the conversations here today. And I'm hopeful that this is going to improve regulations for years to come. Thank you.
Great. Thank you so much to all of our leadership for coming today and showing your support. Now we're going to turn to a part of the program where we've got panels talking about specific focal areas in the report. My name is Emily Pendilli. I'm Assistant Director for Ecosystem Services and Natural Capital Accounting at the Office of Science and Technology Policy and a co-chair of the subcommittee on the Frontiers of Benefit Cost Analysis. I'm really pleased to moderate this first panel session, which is going to explore non-fatal health effects, ecosystem services, and wildfire and extreme events focal topics. These three focal topics were highlighted as important frontiers in benefit cost analysis in the report. The first is non-fatal health effects, things like liver disease, low birth weight, and mental health, and how those effects are captured in benefit cost analysis. The second focal area is ecosystem services effects and how these benefits derive from nature, such as recreational and subsistence uses and climate mitigation, are incorporated. And then finally, we'll hear about wildfire and extreme weather effects, and including benefits and costs such as disaster relief, risk reduction, and resilience building efforts. So I'm pleased to welcome agency and academic experts across these three topics. First, let me introduce Al McGartland, Director of the National Center for Environmental Economics with the Environmental Protection Agency. Al, over to you.
Thanks, Emily. Yeah, EPA is thrilled to participate in this new initiative. I want to give a special shout out to the research community listening today. In many ways, we view the research community as a wholesale operation for our analyses, right? And regulatory agencies like EPA, we're the retail operation. We rely on academic research to advance our analysis that not only informs decision-making, but also informs the broader public about social returns and impacts achieved by regulation. That indeed is why this effort is so important. Systematic identification of priority gaps in EPA analysis is long overdue. Indeed, it would be very hypocritical, it seems to me, if you push for greater use of benefit cost analysis, but don't insist that that benefit cost analysis be as complete as possible. So getting to the matter at hand, EPA is finding itself with many new challenges. For example, according to the Toxic Substances Control Act inventory, there are 42,000 actively used chemicals. And under that law, TSCA, and when relevant under the Safe Drinking Water Act, we need to assess and review the risks, costs, and benefits of these chemicals. And to regulate these chemicals, we must be able to inform on these risks. The work we're doing on PFAS, for example, is a good example for the frontiers of benefit quantification. We thought we took this to a new level. Nonetheless, in the PFAS drinking water rule, EPA identified 12 health endpoints that we consider likely effects of PFAS exposure. Yet we could only quantify 5 of them because of the dearth of research on the other 7. Health risks left unquantified included developmental effects for small gestational age and the risk of osteoarthritis and bone mineral density. TSCA presents the same kind of analytical challenges. This is the program where we regulate chemicals in commerce and use. In the 5 economic analysis regulating chemicals, under TSCA Section 6, which is our existing chemicals program, there were 11 quantified and valued health endpoints. So that's a pretty good job. Nonetheless, these were all 10 of these 11 were all cancer risks. However, there were 15 non-cancer, non-fatal health endpoints discussed in our RIA and our regulatory analysis, but they were neither quantified nor monetized. So to date, EPA has had great success adapting epidemiology from the research community to inform on important dose response information that allows us to quantify how risks change when regulations reduce exposure. These studies have been employed very successfully, for example, when we regulate the benefits of criteria air pollutants. We need sort of an equivalent database or equivalent science for all these other 42,000 environmental contaminants, including how risks change even at low doses, as the director mentioned earlier. Lastly, there's a large array of health endpoints that need to be weighed by how frank these health effects are, right? One health effect is not the same as the others. Economists do this by estimating society's willingness to pay to avoid such risk. This research is also needed to allow us to aggregate all these benefits into a single metric, namely money, so that we can easily compare that with the cost of regulation. Thanks.
Thank you so much. Next, let's welcome Christian Crowley, an economist in the Office of Policy Analysis at the Department of the Interior. Christian?
Thanks, Emily. Interior is thrilled to be here as well and very happy to be part of this effort. I'll say a little bit about ecosystem service valuation and quantification, then a little more about wildland fire management. So first off, on ecosystem service valuation and quantification, just an overview here that ecosystem services include a range of valuable things that we get from nature, as Emily noted at the top. Things like timber for our homes, pollination for our food crops, clean air and water, protection from fires and floods, and landscapes for recreating, fishing, hunting, and preserving cultural connections. Nature provides these inputs to our economy for free, so they are likely undervalued in decision-making and in benefit cost analysis in particular. So when we undervalue these resources, we know that we risk losing them. Last year, the federal government, under Dr. Eli Fenichel leading, us launched a 15-year effort to develop some environmental economic accounts for the United States. And I think Dr. Fenchel will be speaking about that in his remarks coming up. But the idea here is to track the quantity, quality, and values of a whole range of resources and services, including air, water, land, and offshore areas, birds, fish, wildlife, and pollinators, energy, minerals, soils, and other geologic assets, forest, wetlands, and other habitats, and urban green space, and environmental activities and jobs. Assembling these quantities, qualities, and values in these accounts really supports a range of analysis and decision-making that we do in the federal government. We can use the baseline information to tell us about the state of our resources today, and then we can track these accounts over time to tell us something about how we're doing. We can evaluate the effects of our actions and our decisions. So for one example, a very visible application here would be fire and flood protection. This is a cross-cutting priority in the natural hazards account that we're developing. Maybe a less visible example would be pollinators that I mentioned just a moment ago. The vast majority of our crops and ecosystems depend on insects and other animals for pollination. And it's not just honeybees, it's also moths and mice and bats and all kinds of creatures. But their numbers are falling in the United States and worldwide. One question we might ask ourselves is, how grave is this issue of falling numbers of pollinators? Well, we know what's at stake if we risk losing our agricultural crops, because we have some market values for those. There's a lot yet to learn about what we stand to lose as other habitats and landscapes are affected. So quantifying and valuing ecosystem services can help us understand the trade-offs involved in managing resources to support pollinators. And that can be just choosing the right approaches, locations, and the scale of our efforts, like restoring land and maintaining native plant diversity. So I'll say a little bit about wild and fire management, a slightly different area of our portfolio. But last year's Forest Service wildfire crisis strategy came out, and that focused on forest health and what we can do about it. And really that forest health ties directly back to the ecosystem services that I was just discussing a moment ago. Wild and fire management is a very complex activity. We have natural, socioeconomic, and cultural factors that can affect the way we do our management. And these factors vary across geographies, with seasons and other circumstances. It's very challenging to do a case-specific benefit cost analysis, even more so to put together a national program and do a benefit cost analysis on that. Wild and fire managers have a range of tools available to support the best outcomes for society, including controlling and containing fires when they start, pre-fire maintenance of the grasses and trees that accumulate over time and act as fuels for fires, and also post-fire rehabilitation of burned areas to stabilize the soils, protect streams, and allow landscapes to recover. Working with communities to prepare for fire and protect valuable assets can occur at all points in wildland fire management timeframe. These tools also complement each other, so fires are easier to control in areas where fuels have been well managed. Rehabilitation, in turn, is easier when fires are managed for intensity and spread. Likewise, fuel maintenance up front before a fire is easier to do in a rehabilitated landscape that's got good, well-functioning ecosystems and fewer invasive species. And as I mentioned, our communities play a role at every step to improve these outcomes. So these interactions among management approaches really make it complicated to choose the right level of effort in each of these various situations. One example I can offer is how much fire is the right amount. Some fires are beneficial: prescribed fire, managed and protective fires, fires as a part of tribal cultural practices. These reduce the risk of catastrophic fires later. They support landscape and ecosystem health, and they strengthen our cultural connections. But even these fires have costs, like the public health effects of the smoke that they generate. So improving our understanding of these trade-offs helps to support decision-making and lets managers know when and where fires can be most beneficial, help us set the right amount of beneficial fire to put on the landscape. Beneficial fire is discussed in September 23's Wildland Fire Mitigation and Management Commission report. This is fresh off the press, and it's a call for understanding more about how effective our various approaches to wildland fire management are, especially over the long term. And I'd just like to note that Dr. Jackson emphasized this at the top of the roundtable in his introductory notes. Really, this long-term effect is what we're looking to understand more about. Thanks, Emily.
Great, thank you so much. And finally, I'm going to turn over to Eli Fenichel, a professor of natural resource economics at Yale University.
Thank you, Emily. And thank you for including me in today's event. This is very exciting. It's exciting to see the report. I would say it's even more exciting to see the process that Dr. Prabhakar talked about at the start of the session. This is modernizing regulation. It's not just guidance, but a plan for learning and striving to use evidence better and better over time. You know, earlier this year, it was really great to see the new version of A4 get finalized and a bunch of the guidance documents, the draft ecosystem service guidance. And this is just such an amazing compliment because you read those documents and you realize, I'd like it to say this. Oh, wait, they need this to be timeless. This needs to be like, not just what's happening now. And this document just gives the like what's happening now, what's the bar today, with the idea that it'll change and evolve next year. That's super cool. And as I was reading through, I was like, this is so rich. I'm going to forget stuff by the time I get to the end that I want to remember. And I couldn't help but think that like the next logical step is for this to be like the outline for a Copilot tool that pulls from regulations.gov and academic literature and puts it all together for people like Al and Christian. It's like, you know, sort of the new version of Clippy popping up and helping them with their regulatory analysis. It was just so cool. It's framed exactly like that in my mind. As I kept reading through the report, like I said, it's just really rich. And then I'm like, oh, wait, I'm going to use this in like, and my colleagues are going to use this in NSF broader impacts. Everyone teaching benefit cost analysis really should be reading this because it's like, you know, 3 weeks of course material right here. And it's really great and up to date. I love it. And then I saw the appendices and I was like, whoa, I don't have to tell students, I don't have to sit down with students anymore and sit and brainstorm ideas because they just gave us lists for all these undergraduate and graduate student projects that are really great and like precise enough to actually get students off and running without being overly constrained. And what's cool about these is when you're in academia and you want to do policy relevant research, you've got to have a relevant topic, but you also have to say like what's relevant to the broader like academic profession. And this is really set up, and I'll come back to some of those things in a moment because I just think it's great. The next step that I see, the next logical step from this that I hope will happen is in the next report, there'll be a summary of the research that's responsive to this. And that research will be cited in a harmonized way. And I think the one thing that I would love to see this go further is to really see what research in sort of a harmonized citation way reflected back to academia, because that sort of documentation is super helpful for us in academia when we're thinking about hiring, promotion, tenure, all of these discussions. This comes up, who's getting influenced? And it's about the lowest cost thing the federal government could do to motivate more research to fit these needs. So I hope that's part of like the next year's project when there's responsive research. What I really liked about this was the systematic focus. I think it's really easy to think about benefit cost as a very narrow, what we might think of as partial equilibrium. One little thing just has a direct impact, very short. And this really says, no, we need to step back and understand all the interactions. It needs to be data driven. It needs to pull from multiple agencies. It was great to see projects from agencies with expertise in physical and natural sciences, working with agencies with expertise in social science. It pulls out these really interesting topics that are interesting to academic economists more broadly and connects them to the important policy questions, which is wonderful. So some of the ones that really struck me was the notion of the importance of substitution effects, the importance of cross-price effects, and particularly cross-price effects where the price is not a market price, but perhaps an implicitly measured or shadow price. I think this is incredibly interesting. I think the work on sublethal effects and all of the writing around there, it's not just the sublethal effects that Al was talking about in a very concrete way, but it's also interesting how what sort of externality cascades and the idea of you can create these passed on externalities or create further constraints. So all of this can be tied together into just great research projects for academic economists. And the importance of the ecosystem services and natural hazards, well, as Christian said, it connects wonderfully with the new system of natural capital accounts and environmental economic statistics. And the reason I say this is that so many of the effects that Christian and Al were talking about, they can be broad and diffuse. And so we really need the systematic viewpoint, and those natural capital accounts, those environmental economic statistics, will work with other national economic statistics to create baselines that will allow us to think about change and ultimately let us separate the unintended consequences of regulations that can be avoided because they're no longer unanticipated.
Great, thank you so much. Thank you all, packed in a whole lot. And now over to Elena.
Thanks, Emily. Hi, everyone. My name is Elena Patel. I'm a senior economist with the Council of Economic Advisors and one of the co-chairs on this subcommittee on the frontiers of benefit cost analysis. I'm really delighted to be moderating this panel session, which is going to move on to two different topics that are covered in the report. One, public benefit programs, and the other about the value of information. When we refer to the value of information, what we're talking about is how information and transparency effects are incorporated into benefit cost analysis. And here there's an emphasis on the quantification of benefits and costs that actually improve information to society. So this focal point raises challenges in valuing accurate and transparent consumer information in various markets for goods or services. So for example, baseline evaluations that I think will be forthcoming on the development of artificial intelligence and how that affects society. The second focus in the report that we'll talk about in this panel is public benefits programs, which I know several speakers have already touched on, I think, because so many of us think so hard about these. And in this context, we're trying to elevate the notion of how to evaluate long-term benefits to program recipients. So there are compliance costs and barriers to access, we have long-term outcomes, and then the cost savings of one government program as relates to another government program. So these are some of the challenges that this focal point raises in the report. And as a very concrete example, you could think about estimating the long-run welfare effects of nutritional support programs and how those nutritional support programs affect the long run, and also maybe affect the welfare of people other than the direct recipients, so family members of those that receive nutritional support. Our panelists today are joining us from agency and academia that are going to be talking to us about these topics. So first, I'm really delighted to welcome Erin Kersley, a senior economist with the Department of Health and Human Services. Erin, thank you.
Hi, thanks for the intro and invitation. So I'm Erin Kersley. I act as the departmental lead on benefit cost analysis and regulatory analysis for HHS. I'm excited to be a part of today's rollout and specifically to talk about two focal categories important to my department. Before that, I want to thank the co-chairs for their efforts on the report and for facilitating dialogue across federal agencies on our shared challenges through the subcommittee. On to the focal categories. Chapter 5, Effects of Public Benefit Programs, notes that analyses of these programs often focus on the impacts on federal expenditures, including monetary transfers from the governments to individuals and the costs associated with program administration. This is critical information for policymakers. However, as the report discusses, we have plenty of opportunities to explore additional real-world consequences of these programs. And I'll just highlight two areas from HHS's regulatory portfolio. First, the Centers for Medicare and Medicaid Services publishes annual rules to update payment rates for the programs they administer. The corresponding analyses quantify impacts on federal expenditures, which is essential. However, additional work could speak to how these actions affect healthcare utilization and, of course, the long-term health consequences of program participants. In analyses of other programs, we've assessed utilization changes and outcomes within the programs, but sometimes face challenges when attempting to extend the scope of the analysis beyond the program. For example, in October 2021, HHS finalized rulemaking to revise the regulations that govern the Title X Family Planning Program. Alongside the final rule, we published an analysis that projected changes in utilization, reporting estimates of the additional clients served by grantees and additional services provided, such as cancer screening, STI testing, and additional services provided related to contraception. Post-implementation, we've observed increases in several key metrics of that program, such as a 56% increase in the number of family planning users and an 80% increase in the number of confidential HIV tests performed. However, additional information could extend the scope of analysis to differentiate between measured program impacts and the net impacts on the United States. This would account for any shifts in services performed by providers outside of the program to within the program and vice versa. So switching gears, Chapter 4 discusses the role of government in providing useful information to citizens, enhancing their understanding and empowering them to make better informed decisions. One challenge is that the existing research linking information and health outcomes focuses on whether information is provided. However, we often consider policies that address the quality of information. So we need to assess the impacts of improved information and the presentation of information rather than the provision of information. We routinely study these topics through consumer testing that measures consumer understanding of the information. However, to consider potential health benefits, we would also need to consider how the improved understanding translates to changes in consumer behavior and those outcomes. There's a ton of opportunities to make progress here. One last point on this topic. When we've lacked this type of study, we've looked for other evidence, including to field surveys and apply stated preference methods that measure the willingness to pay, providing a direct estimate of benefits of the particular intervention and use those findings in analyses. So I'll stop there, but thanks again to the co-chairs and the subcommittee. I'm really enthusiastic to learn from our academic researchers and other partners outside of the government. Thanks.
Thanks, Aaron. That was excellent. It is now a real pleasure for me to introduce Judy Scott Clayton. She's a professor of economics and education at the Teachers College of Columbia University. She also just left us from CEA. She served as a senior economist during the last year and was one of 3 inaugural co-chairs in lifting up this initial report. And so big thank you to Judy for all the efforts she did to lay the groundwork for this report that everybody can take a look at today. Judy, you're muted still.
My clicker was not clicked hard enough. Okay, thank you. It's a real pleasure to be here and to see how this report has come together, like Eli, like Dr. Fenichel was describing, just a great sense of enthusiasm, both about the first report as well as how it might evolve and continue to play a role over time. So there are a lot of challenges that are noted in the report. So kind of challenge number 1 for both the research and policy community is, in any given context, any given rulemaking, how do you try to figure out which of these challenges are really the primary ones for your context? So I'm just going to call out 3 that I think come into play in these areas with respect to higher education policy, which is my main area of research. But I think they have applicability far beyond that as well. So I tried to pick ones that could be more general. So one, I think, is understanding the role of benefit take-up, both for understanding overall costs and benefits, as well as for understanding how those costs and benefits are distributed. It's very exciting that the revision of A4 includes now much expanded guidance on distributional analysis and also mentions take-up for the first time. It actually was not in the 2003 version. And it's also exciting to see these highlighted in this report. In higher education, major recent policy reform efforts to streamline the student aid application process, as well as to reform income-driven student loan repayment, were really driven by evidence, research evidence that many of those who stood to benefit most from these programs were the least likely to take advantage of them. So this isn't just about affecting the costs of these benefit programs, but also the take-up patterns can completely disrupt the distribution that we might have expected based on how the eligibility criteria were written. And I think that's a problem that cross-cuts a range of agency rulemaking. A second issue, and really the issue of take-up leads also to the challenge of how we value improvements in information. In some contexts, certainly with respect to student loan borrowing choices, as well as choices about where and when to use student aid at different institutions, changes in the content or the quality of information can change those patterns of whether and where students use their aid. There's a lot more research on this now than there was 10 years ago, a greater appreciation for its value, but there's still a lot more to be done, including longer term assessment of the role of information in changing markets. So even if it doesn't affect individual consumer choice at the outset. If other parties or other groups are using that information to change, to do their own evaluations or to change how they communicate with students and consumers, that can have an impact over the long term. Finally, and this also connects to the previous discussion of non-fatal health effects, I think much more work is needed to fully incorporate the risk and precarity reducing aspects of public benefit programs. For example, in student loan repayment, many analyses still can't really attach a quantitative value to forgiving a loan that is not expected to ultimately be repaid. So forgiving it now versus forgiving it in 30 years might be, pretty much the same to the government, but it may be experienced very differently by those who are in repayment. Okay, so I know we're going to talk more, another panel is going to talk more about directions for progress going forward. I just want to lift up a few. First, cannot overstate the value of sustained efforts to improve administrative data sharing, both across agencies and with outside researchers. Advancements in this area in higher education have dramatically improved our understanding of how students respond to benefits and what their outcomes are. I would also highlight the report notes the potential for agencies to bring in outside researchers for time-limited roles. Hopefully that brings some help to the agencies while we come in and we're trying to do the best we can to learn. But really, I think that the real impact is after that, those people go back and they have a much better understanding of how kind of the real world of policymaking works. And then finally, I think Eli was hinting at this earlier about how do we incentivize this type of research in academia. And I'm not sure that I have a good way to, or many researchers have a good way to say, hey, this report, this agency rulemaking cited my work, or this government report cited my work. It's kind of piece by piece. So if we had a central repository where you could really have a better measure of how your work is being used in policymaking, I think reward systems could develop around that. So thank you again for inviting me. I'm excited to hear what everyone else has to say, and I'll stop there. Thank you.
Thank you so much, Judy. So last but not least, I'm really excited to welcome Jamila Michener, Associate Professor in Cornell's Department of Government. Jamila's research focuses on poverty, racial inequality, and public policy within the U.S. with an emphasis on health and housing. And so I think she's going to nicely complement both of our previous speakers to be able to talk both about public benefits programs and the value of information. Thanks, Jamila.
Oh, thanks, Elena, and thanks to everyone for having me here. I was frankly a little surprised at the invitation because I thought, but I'm not an economist. And so I love the big tent approach here of incorporating perspectives from a variety of disciplinary backgrounds. Certainly when it comes to benefit cost analysis, I think it is a zone, a sphere that we primarily associate, and rightly so, with economists, but you'll forgive me for maybe taking this conversation in sort of my own direction, just given my own approaches to this kind of work, and in particular, my own approaches and research around public benefits. So, I teach a course at Cornell called The Politics of Public Policy, and we actually spend a lot of time talking about tools of policy analysis and understanding. We spend time talking about cost-benefit analysis and so on and so forth. And so I tell my students every year when I teach this course that benefit cost analysis is a tool. And like any tool, it doesn't actually have an inherent or an inevitable value or valence, right? It's not some sort of unalloyed good or a panacea, but it is a tool that has a lot of advantages. And those advantages can be leveraged to do good. It can certainly be used to enhance equity and effectiveness, particularly with respect to public programs that affect tens of millions or hundreds of millions of Americans. But it can also be, if not really if we're not really intentional and we're not thoughtful, can be used in ways that often inadvertently, but nonetheless can produce downsides, right? And or can mask important aspects of the design and administration of public programs that we need to be attentive to. So a key question I'd like to take just a few minutes here to speak to is how we might think about the ways of leveraging the good of benefit cost analysis maximally, while minimizing any potential downsides, right? And what I want to suggest is one pathway for leveraging the benefits and minimizing potential downsides is to create space in our thinking and resources in our practice for taking into consideration the value of qualitative information and qualitative approaches. And I want to suggest that even if a quantitative or quantitatively oriented approach to benefit cost analysis is the mainstream, the primary way of doing the analysis, I think that's perfectly appropriate. But I want to suggest that complementing, supplementing, and verifying that quantitative analysis with robust and systematic qualitative approaches can produce a benefit cost analysis that has a lot more value to us, and that potentially helps us to avoid some potential risks or downside here. Now, in the report that we've all been talking about so much today, which I agree is a great report, and I, the semester is over, but I still sent it to my students. I was like, I know I shouldn't be emailing you. I should leave you alone. It's finals, but you all should look at this report in part because so much of what we talked about in our policy class this semester emerged in that report. And so it was exciting to read, but there's one line that stood out to me that says, agencies will continue to exercise judgment and rely on qualitative description of effects when further quantification or monetization is not feasible or appropriate. And I want to push and go so far as to say that even when quantification and monetization are appropriate and feasible, we should still, agencies and others and researchers should still continue to rely on and supplement and complement quantitative approaches with qualitative work. In the context of huge data infrastructures and ever proliferating sources of data, the call for more and better quantitative data is quite common and even appropriate. This can be valuable. But the growing cascade of quantitative data and the deepening fascination with the power of big data can sometimes crowd out the vital and valuable knowledge and role of textured experiences of everyday life informing the improvement of our public benefit systems. And often, I just finished a big 3-state study where we interviewed over 500 Medicaid, SNAP, and WIC beneficiaries about their experiences with those programs. We learned so much from them by sitting down and spending an hour talking to them about the textured details of their experiences with those programs. And many people said, thank you for talking to me. I can sometimes feel like another statistic, right? A cog in the wheel of this larger system. I think if we're honest with ourselves, part of the reason why so many people express that kind of sentiment is because it's true. As far as we our approaches to understanding these systems, people can often become statistics. And I think when instead we think about how we can hear from people in ways that are systematic but direct, in ways that are comprehensive but textured and nuanced, we can catch, there are all sorts of benefits that come from that. We can catch small problems before they grow into larger problems. We can identify pain points that maybe only affect particularly vulnerable or small subsets of the population that might be harder to pick up on when we're looking at more aggregate or macro kinds of trends. We can understand how problems are happening, not just what the problems are. So in a system like Medicaid, for example, we often talk about, I do a lot of research on Medicaid. We often talk about things like underutilization or overutilization, and that's really important. It has to do with cost control and so on and so forth. But by having conversations with people, you can sometimes understand the logic of overutilization and underutilization, right? As an example, I was doing interviews with Medicaid beneficiaries, qualitative interviews with Medicaid beneficiaries during the pandemic. And many of them were people who for years prior to the pandemic could not manage to qualify for Medicaid, but because of changes that occurred in their lives during the pandemic, they suddenly qualified. And what they did as soon as they got those benefits were they went out and tried to get every procedure they could possibly get, because they thought once this pandemic is over, I might lose these benefits again. Now we can look at the data and think, why was there such overutilization during this period of time? When we talk to people, they can explain to us their choices and help us to make sense of larger patterns that might otherwise seem inefficient, but in fact are reflecting quite something else. We can also get ideas from people when we talk to them about how to conceptualize costs and benefits, right? So the starting point of what counts as a cost, what counts as a benefit, in what context, to what end, those are questions that we can take for granted, but that people often have specific ideas about, right? So for example, when I talk to people about their access to what we think of as, you know, a wider scope of benefits in Medicaid, things like dental and vision, you know, many people will say, you know, the state doesn't want to pay a lot for dental, and so we can get our teeth removed, but we can't get dentures. We can't get teeth put back in. And people will explain, this is why I haven't looked for a job. This is why I've pulled back from community, because I don't have teeth in my mouth. And so when we're calculating the cost of a dental program in a state, and we're thinking, well, you know, we will pay for extractions because they lead to other health problems, but dentures we won't pay for. It's not clear that we can fully conceptualize the cost of that for people's civic lives, for their social lives, for their employment, without really understanding from people what those experiences mean. Finally, we can learn from people about—
Jamila, I'm sorry to interrupt you. We're going to have to wrap up now, but we are loving what you're saying. Nope, that's okay. I appreciate it. I just wanted to flag that it's time to wrap up. Thank you.
My phone went blank, so I couldn't see my timer, but I was wrapping up anyway. And I think the points were really clear just around how much we could learn through these qualitative emphases. So thank you, everyone.
Yes, and thank you. I think it's really great to underscore the value of qualitative information. That's something that can be hard to pull through reports. So thank you for that perspective. Jeff, I'm going to hand it over to you.
All right, thank you very much. So I'm Jeff Schrader. I'm a senior advisor at the Office of Information and Regulatory Affairs, or OIRA, and I'm also one of the co-chairs of the Frontiers subcommittee. This session will be on two of our cross-cutting issues in the report, and that is distributional analysis and risk analysis. These are cross-cutting issues because they come up basically everywhere in analysis of government actions and cost-benefit analysis. So if you think about risk, for instance, you know, think about something that's a rare but really disastrous event. So a statistically rare extreme fire, for instance. An agency that wants to take action to, say, prevent this risk needs to grapple with the fact that the evidence might be uncertain about how effective their action might be. They need to grapple with the fact that people have preferences over reduction in risk, and how do you put a value on that when you're doing your benefit cost analysis. They have to grapple with, if they're doing information policy, how people respond to communication of information about risk. And these issues come up over and over and over again across all sorts of different regulations and actions. On the distributional side, we know that government actions affect different groups of people differently. And yet it's all too common that when we do analysis of actions by the government, or we do a cost benefit analysis, we do not take into account the differences in those effects across different groups. And so I'm especially interested to hear about this cross-cutting issue and how we can make progress in analyzing distributional impacts. We have three panelists. We're going to start off and get an agency view from Kate Quigley, who's an economist at the NOAA. Kate, take it away.
Thank you, Jeffrey. Good afternoon, and thank you for the opportunity to provide input on this important topic. I will be speaking in my capacity as the senior economist at the NOAA Office for Coastal Management. The Office for Coastal Management provides coastal management, science, data, training, and tools that ensure healthy coastal resources. NOAA conducts benefit cost analysis or benefits valuation on our programs and projects to determine the benefits of services provided and opportunities for improvement. There are three key considerations which can improve our ability to confidently assess the distribution of these benefits. Number one, expediency and PRA approval to conduct data collection on benefits of NOAA projects. Number two, a central location for studies useful for benefits valuation, and I'll explain that in just a moment. And number 3, an exploration of alternative or supplemental approaches in traditional economics valuation methods. So for the next few minutes, I'll explain what I mean by the 3 of those. The process of benefits valuation presents a number of challenges when considering the distribution of benefits across different populations. In many cases, NOAA needs to assess what benefits it can provide to the communities and underserved populations where its projects are based. Projects may include restoration of wetlands and enhancement of recreational opportunities, implementation of natural infrastructure or green infrastructure to minimize sea level rise and other inundation, and preservation of natural areas that protect property from erosion resulting from coastal hazards, among many other projects. Assessment can involve gathering data from the local community that shows what the benefits are of various projects to local stakeholders, which may require expediency and PRA approval for relevance for timely use of funds. This data can feed into benefit cost analysis at the design stage with actual evidence. Now, this is the case when funding exists to conduct primary data collection. So we're talking about focus groups or surveys. However, due to funding and capacity issues in employees, we are more often than not limited in our ability to conduct primary benefits valuation studies. So instead, we often rely on a process called benefits transfer, in which we transfer the benefits from an existing primary valuation study that exists elsewhere to our study. This approach is much less expensive than primary data collection and is widely used and accepted. For example, our Coral Reef Conservation Program is currently utilizing benefits transfer to update the ecosystem service values of 9 coral reef jurisdictions across the United States. This multi-year effort has demonstrated that values attributed to services provided by region and demographic group. So unfortunately, many of the coral jurisdictions being assessed do not have a sufficient number of studies we can rely on. In some cases, for some services, there are no studies at all in areas with lower populations. In other cases, some stakeholders want a more holistic view of ecosystem services or have a different understanding of ecosystem services in their valuation entirely. Those studies that do exist are often not clear on how benefits are distributed across different groups of people. For that reason, we are proposing that a central database for primary ecosystem service valuation studies would enable us to decrease our search costs and to understand the gaps early on that exist in the database so that we can create a proactive plan to address them with local stakeholders. Further, it may spur increased efforts within academia to bridge existing gaps. We would also benefit from research and guidance focused on alternative approaches or supplemental approaches to some popular non-market valuation methods. Traditional valuation methods that economists use, like damages avoided, estimate greater values for areas with higher property values. This has been mentioned before today, potentially leading to inequitable allocation of funding for improvements to ecosystems and their associated services. Travel cost, that is another economic method, and opportunity cost method also have equity challenges because they produce a higher valuation for activities or places with a high cost of participation, thus favoring higher income individuals who can afford to absorb the barrier to entry. These differences in monetary values between groups can potentially result in allocation of funding for improvements in ecosystems in areas inhabited by higher income groups at the expense of lower income groups, or areas that will not receive funding or attention. And many of these projects protect property and individuals from inundation and floodwaters. The Corals Valuation Study mentioned earlier is trying to overcome this by exploring how stakeholders in different areas respond to various non-monetary measures of value using indicators of value or ranking of ecosystem services. We expect this information to be useful in tackling some aspects of this problem, but we recognize that this alone cannot overcome the challenges of assessing the distributional impacts of our programs and actions. We would benefit from comprehensive guidance which extends beyond traditional valuation methods that economists typically use to thoughtfully incorporate benefits that are both readily monetized as well as certain benefits which are not readily monetized. This report provides much needed acknowledgement of challenges in identifying distributional benefits and benefit cost analysis, and we appreciate involvement in this work. Thank you.
Thanks so much, Kate. Now we're going to turn things over to Jason Schwartz. Jason was a former co-chair, inaugural co-chair for the Frontiers of Benefit Cost Initiative. So it's great to have you back, Jason. And now he's back at NYU, where he's the legal director at Institute for Policy Integrity. Jason, I'm curious if you can tell us more about where you see important areas for improvement on risk analysis and benefit cost analysis.
Well, thanks so much, Jeff, and thanks to all of the co-chairs for inviting me to join for this exciting launch. It's really a privilege to be back. And thanks for that important question, Jeff. I'll do my best to address. So for each of the report's focal effects, there are crucial opportunities for the research community to improve the understanding of risk. So to assess the costs and benefits of wildfire interventions, for example, we first need to estimate how interventions will change the risk of wildfire. To assess the effect of an information disclosure, we may need to better understand how risk preferences will influence people's incorporation of new information into their market behavior. And what is the cost, for example, of the fear of risks, such as the dread people experience after exposure while waiting on whether serious but uncertain health effects will occur? The report is really rich with prompts for research like these into risks across all the focal categories. And I really encourage researchers to study the report carefully for such topics. But I'd like to use my time today to encourage researchers to also read the report in conjunction with OMB's recently updated Circular A4 on regulatory analysis and its guidance on uncertainty and risk. So Circular A4 details a variety of tools to help analysts better quantify risk and uncertainty. And I'd like to encourage the research community to help agencies apply those tools to this report's focal categories. So take probability distributions. Circular A4 encourages agencies to quantitatively characterize probability distributions when feasible. And the interagency working group's estimates on the social cost of greenhouse gases are one powerful example of when agencies have deployed probability distributions. When developed in 2010, those estimates of the social cost of greenhouse gases could not yet capture the risk of low probability but high impact climate catastrophes, like the collapse of polar ice sheets. To reflect collective willingness to pay extra to avoid such high impact risks, the working group presented estimates drawn from the 95th percentile of the distribution of estimated costs and encouraged prominent consideration of such high impact values alongside central estimates of the social cost of greenhouse gases. Now, this was admittedly a rough proxy for risk, but it was better than ignoring risk completely, and it worked. For years after, agencies routinely considered not just the central estimates of the social cost of greenhouse gases, but presented a range of estimates, including those high impact values based on the 95th percentile. And showing the probability distributions this way gave these estimates better context and bolstered the common understanding that the central values were most likely underestimates. But this kind of attention to probability distributions is really too rare, and too often important benefits and costs are presented as single point estimates that do not reflect risk and uncertainty. So I'd like to encourage researchers to consider what effects in this report's focal categories could be better quantified using probability distributions. Could researchers help develop, for example, high impact 95th percentile type estimates for other extreme weather events? Of course, probability distributions are not always feasible. We may lack data or estimates of key parameters. And here, Circular A4 notes the potential role of expert elicitations to fill in key gaps and allow the creation of fuller probability distributions. So here I'd like to encourage researchers to consider which of the report's focal effects have gaps where expert elicitation could help address uncertainty. Could, for example, expert elicitation help us better assess the value of information in light of risk? Circular A4 covers several other tools, but the last one I'll mention is real options. Analogous to stock market options, real options assigns value in light of information about potential states of the world that can be learned over time. So for example, a policy to protect natural resources today may preserve option value associated with future uses of those resources that are unknown today. The idea of applying real options to benefit cost analysis has been explored in the literature for decades, but few agency analyses adopt an options framework, even qualitatively, let alone quantitatively. Can the research community advance the methods needed to bring an options framework to agency analyses? Could, for example, an options framework help assess the value of protecting against irreversible risks to ecosystem services, like the risk of pollinator collapse? So these tools to address uncertainty, probability distributions, real options, expert elicitations, and more have long been recommended in Circular A4. And I'd really encourage researchers to study this report carefully, to look at the section on risk, and think about which of these tools may be ripe to help better quantify the focal effects prioritized in this Frontiers report.
Thank you so much, Jason. And thanks for all your work to get the report out. So finally, we're going to hear from Matthew Adler, Distinguished Professor of Law and Professor of Economics of Philosophy and Public Policy at Duke University. Professor Adler, you're one of the world's leading experts on distributional analysis. So I'm hoping that you can tell us how this can be incorporated more frequently into a benefit cost analysis in a very helpful way.
Well, thanks so much for inviting me to participate in this panel. Yeah, I'm a professor at Duke University who works on benefit cost analysis. Let me say these comments express my own personal views, not the government's and not Duke's. So Circular A4 does not mandate distributional analysis when agencies conduct BCA, but gives agencies discretion to do so. And the circular provides guidance as to how to undertake a distributional analysis. So one type of distributional analysis involves distributional weights that correct for the declining marginal utility of income. The circular does not mandate this approach, but it allows for distributional weighting. In my own view, and again, I'm speaking for myself, not the government, BCA with distributional weights is one of the most rigorous types of distributional analysis that agencies can conduct. It systematically corrects unweighted BCA so as to align with overall welfare. And it's a great advance that Circular A4 allows this type of analysis. So let me speak to distributional weighting and how the research community can assist. Distributional weights, as anticipated by the circular, are a function of an individual's income. A specific weighting function is advised. The research challenge, as I see it, is to develop better models and approaches for predicting costs and benefits by income group. Distributional weights vary by income group. That's the whole idea. Specifically, higher income individuals have lower weights to reflect the fact that the marginal contribution of income to well-being decreases as individuals become richer. So we need to predict both the costs and the benefits of regulation by income group, and ideally by more finely divided groups. Income deciles, for example, would be better than income quartiles. The costs and benefits, if not already expressed in monetary terms, should be monetized by income group. This allows us to calculate the net monetized benefits or net monetized cost of the regulation by income group, and then to multiply that amount by the distributional weight for that group to arrive at the weighted net benefit. On the cost side, predicting the cost of regulation means improving models of cost incidence. Imagine that an environmental regulation requires firms to install some technology. Those costs will be spread among workers, owners, and consumers, depending upon demand elasticities on the consumer side, on the supply curve on the labor side, and on the market structure of the industry. It's possible that consumers will ultimately bear most of the cost, or instead that workers or owners will. For purposes of distributional weights, understanding the incidence of regulatory costs is very important because the incomes of workers, owners, and consumers will generally not be the same. So we need to predict cost incidence on these economic groups to understand the distribution of income within each economic group, and thereby to predict the incidence of regulatory costs by income group. The research community can help in developing better models and data for doing so. Now, on the benefit side, characterizing the incidence of regulation's benefit by income group is equally important for the application of distributional weights. This will mean looking at each type of benefit of the regulation: fatality risk reduction, non-fatal health improvement, ecosystem service benefit, informational benefit, etc., and doing a distributional analysis with the ultimate aim of understanding the incidence of the benefit in natural units by income group. Once we have the incidence of the benefit in natural units by income group, we would, at least in principle, multiply that by group-specific willingness to pay so that we have the incidence of the benefit in monetary units by income group. This can then be combined with group-specific costs to arrive at a net monetized benefit of the regulation by income group, and then apply distributional weights. Now, I should note, with benefits, there is a shortcut that can be used.
Just a note, Professor Adler, that we'll need to move on to the next panel soon. So
okay, yep.
Thank you.
Yeah, I'll be really quick. So yeah, the bottom line here is that, from my perspective, at least for purposes of one form of distributional analysis, the use of distributional weights, the research community can assess by improving models for understanding both the incidence of costs and the incidence of benefits of regulation by income group.
Thank you very much. Yeah, there's a lot of work on both these issues to be done by the research community. I do hope that people will look at the report and help with that work, as all of our panelists pointed out. So now it's my great pleasure to pass it over to Jane Lubchenco for the next panel.
Thank you, Jeff. Hello, everyone. Thank you for joining us today. I hope you're enjoying these rich comments and ideas as I am. I'm Jane Lubchenco. I serve as the Deputy Director for Climate and Environment Team at the White House Office of Science and Technology Policy. I am just so thrilled with the report that we released today and all that it represents. Among other things, this report is a clear statement that the White House and agencies recognize the importance of staying informed about the cutting edge of research so that we can incorporate new knowledge into policy. We want our policies to be as effective as possible, and that means keeping up with the best, most current knowledge. The report is also an invitation to the research community inside and outside government to pursue new understanding in areas that would be particularly helpful in strengthening or creating new policies. For example, one of the areas I care deeply about is helping agency analysts capture the impacts to people of changes in the environment. We seek to know what the real costs and benefits of changes in nature will be before we make decisions, for example, about infrastructure siting or healthcare or coastal management. In short, we seek to strengthen connections between research and policy, catalyze knowledge breakthroughs in key areas, and then accelerate incorporation of new knowledge into policy. And so to shine a spotlight on these aspirations, we focus our final panel of the day on collectively advancing the frontiers of benefit cost analysis. In doing so, we are joined by two stellar research leaders who have thought deeply about the research policy interface. I'll introduce both of them and then pose a question to each. Heidi Williams is a professor of economics at Dartmouth College and the director of science policy at the Institute for Progress. She researches how to enhance scientific progress and innovation, and how to translate those advances into broad improvements in social welfare. From her experience building a better NIH, dynamic budget scoring at CBO, and partnering with NSF to improve scientific grant making, she brings insights into how government policy can improve collaboration between researchers and policymakers. Kathy King is a professor of applied economics and management at Cornell University and faculty director of the Atkinson Center for Sustainability. Her research focuses on the economic valuation of ecosystem services and integrated assessment modeling for water quality modeling. She has devoted countless hours engaging federal agencies and bringing together the federal and research communities. So thank you both for joining us. We have a lot to learn from you. I know that more and more researchers are interested in doing policy relevant work, but they're often confused about what topics might be most useful, frustrated that doing policy relevant work is not always valued by the academic community, and sometimes in the dark about how to engage with policymakers in the federal government. We'd like to hear from both of you about what you've seen work well in connecting the research community and federal policy, and how the government might incentivize and support researchers who do this kind of work. So let's start with you, Heidi. What have you learned about how to produce research that can be used as input into policymaking?
Yes, thank you for having me. Just one small correction. I have not ever had a formal affiliation with the Congressional Budget Office, so I can talk about them from an outside perspective. So I really enjoyed reading the report, and the main bottom line that I would like to emphasize is that in my experience, meaningful policy relevant research usually requires outside researchers developing quite deep understandings of the agencies whose work they're trying to inform, often through direct collaboration or placements. And that was a point that was emphasized in the report, but I think it's one that I would like to give a little bit more texture on, because I think this issue is often talked about at a more abstract level than is helpful. And so I think some specific examples would be useful. So the report endorses temporary agency assignments, which I think are great. And there are a lot of academics that are excited to come to DC for a year or two, like many of the people here. In my experience, agencies are also able to tap a much broader set of subject matter expertise to the extent that they have the ability to be flexible and to kind of offer a wider variety of arrangements. And so I was involved with two over the last few years with the National Science Foundation that I just wanted to credit to them as being what I thought were really interesting and innovative examples. So last year, two academics and I met virtually with a group of NSF staff about every 2 weeks as they were trying to build up a new program that they were starting, which by their own admission was not something very similar to efforts that NSF had done previously. And so basically our work with them focused on us trying to understand the areas of uncertainty they had and how to design their program and fit it into NSF's traditional mandates, like their merit review criteria, because they were still trying to review these regional innovation grants using their traditional metrics of how do we think about scientific merit and broader impact. And that's not a very straightforward thing to do. And so this group of academics, we met with them about every 2 weeks, basically trying to say, what does the academic literature have to say about informing the areas of uncertainty that the agency had? I think the study group was quite rewarding for the academics. It surfaced a lot of questions that then some PhD students and other academics ended up working on. Made sense from the agencies. They found it rewarding. And it was just a mechanism that I think of as something that's very promising for getting kind of remote short-term subject matter expertise kind of in to help with agencies when they have very specific objectives. The second example I want to say from NSF is this fall they signed a no-cost other transaction authority agreement, which was actually their first OTA that they've signed with the think tank that I work with, the Institute for Progress. For NSF, that OTA was responsive to the CHIPS and Science Act, where they were charged with considering alternatives to or experimentation with different ways of receiving, reviewing, and funding research. And so that no-cost OTA essentially allowed them to share their administrative data with outside researchers, which is something that the agency hadn't done before. And in exchange, as researchers, we're meant to provide them with pilot proposals that NSF can consider implementing internally to test and evaluate new mechanisms. And so because it was structured through a think tank that itself has affiliates with faculty at a variety of universities. It's also kind of a way to tap a particularly broad source of expertise relative to signing an agreement with just one university. A second feature that the report emphasized that I wanted to comment on is it encouraged academics to prioritize the report's focal topics for research and funding. I think that's something where I did enjoy reading the appendices. I think there were a lot of good ideas there. In my personal experience, I think disclosures of the kind that were in the appendix or in the learning agendas on their own are sort of a good first step in the sense of almost like a bat signal of what agencies would like to engage more with for academics, but it should not be seen as kind of the end of engagement with academics. And so I wanted to talk about one example that I've been closely tracking that's similar that the Congressional Budget Office used last year. So in July, after I think they had done it previously, but they had taken a break for a few years, the CBO disclosed a variety of calls for research on their website. And not all academics have this flexibility to do this, but I basically found several of the questions sufficiently interesting that I essentially dropped everything else I was doing for the last 6 months to go work on those. And so, that includes everything from trying to go to census and work out some cross-agency data sharing agreements so that we could do new linkages to try to measure some of the quantities that were in CBO's data or CBO's call for research, all the way to kind of doing more traditional academic research projects and also doing some even less traditional research projects like trying to teach myself enough budget scoring to understand how to think about the mechanics of what they were actually working on. And so again, I know that not all academics are going to have the flexibility. I happen to be on leave, so it was easier for me to do that. But it's just to say that I think a lot of us are interested and that these disclosures can be quite meaningful. Notably, CBO's calls for research weren't paired with any financial support. So every year I get emails from the Social Security Administration with similar calls for research, but they give out grants to academics, to fund work on those. And so I think one distinction, when you think about how are you going to incentivize academics to come in, some agencies just disclose things, some agencies disclose things with financial resources. My friend and collaborator, Paul Niehaus at UC San Diego, has been actually working on philanthropically raising funds to re-grant to researchers that want to work on CBO's questions because Congress has not chosen to provide support for that work that we think is really important. But that's something that I think is just a very natural thing that the government could think about doing on their own. And I think honestly, just highlighting the divergence with the Social Security Administration is sort of a useful area.
Thanks so much, Heidi. We're going to have to move on. Those are really rich ideas, and I appreciate the specificity.
Yeah.
Kathy, you've worked closely with federal analysts. What are some of the lessons that you have learned you'd like to pass on?
Thanks, Jane. Thanks, everybody. First point I want to make is a huge kudos to the Frontiers group, all the folks that put all the work into that document and the leadership that made it happen. Thank you very much. It's super important for all of us and citizens of the world. I want to talk a little bit about the development and implementation of a workshop called The Social Cost of Water Pollution that I started with colleagues in about 2015, 2016. Dave Kaiser was a colleague at Iowa State at the time, and Dan Fneff, somebody I'd worked along with at the University of Wisconsin. We'd long discussed and felt that there was a hole in the linkage between the academic community and the needs of agencies. And our particular research area and interests were water quality and ecosystem services. We felt that there was a need to lift up and engage a group of people. So Dave, with a small grant he had, we held the first very small social cost of water pollution workshop. It was held at Iowa State University. It was Iowa State folks, Minnesota folks, and importantly, we invited EPA to join the table, and Julie Hewitt was at that first meeting. In 2018, I was invited to join Cornell Atkinson, and as part of that, I requested funding for 5 years to build and organize a workshop. That workshop really culminated in the last 2 years with 2 joint meetings held with EPA in Washington, D.C. And the one this last year, just a few months ago, was held at EPA headquarters. The goal of the workshop was to create a community of interdisciplinary scholars, academics interested in undertaking policy relevant research related to water quality, economics, and hydrology. And to do that work, to direct that work towards the kind of answers that EPA and other agencies directly needed to do their job for regulatory impact analysis and benefit cost analysis. Some lessons. First, I personally feel very fulfilled that we really made a difference, and others can give you their reaction. But we had 80 people at this last conference from all over academics who were excited to come and learn not only about what agencies were doing, but learning about what the current and forthcoming future needs. So for example, we had a panel on the national environmental accounts so that academics learned about what was happening there. We had discussions about Circular A4 and all of the other sorts of changes that were happening. Important lessons, incentives, incentives, incentives. Academics came for multiple incentives. Number one, we had the funding to pay their way. Lots of academics simply do not have that. Two, we had people there from the agencies, huge kudos to people at EPA, OIRA, OMB, and OSTP who showed up and engaged with researchers one-on-one, giving the feel to people that what they were doing would make a difference and did make a difference. Three, EPA has had a series of STAR grants that have funded work related to the workshop. Super important. Other quick lessons. There are academics who are out there that desperately want to do this. There's others that simply do not. It's hard to find them. It's important to have networks and pull broadly across the US. Agency engagement, as I already said, was absolutely essential. And the final thing I'll say is that this is expensive, both in terms of time. It took us 5 years to build it. I hope we will have time and funding to continue it, but it takes money. It's a challenge. We're right now looking for funding in order to keep this going. So I hope that gives a little bit of insight into what I think was in fact an effective way to bring academics and staff, economists and others together. Thanks.
Thank you so much, Kathy. Thank you to both of you. A lot of rich lessons learned. To close us out today, I'll now turn the mic over to Ricky, or turn it back to him. He's led such historic efforts to modernize regulations and infuse these efforts with his deep experience, with passion, with humanity and common sense. And so it's really appropriate that he have the last say today. Ricky, over to you, and thank you, everybody.
Thanks so much. And I'm very mindful of the time. I promise we'll be done by 1:30 as planned. So let me just say that I hope that this is very much a beginning. We're celebrating and marking the end of 1 year of really great work by 3 important units of the Executive Office of the President. And we have a plan to continue. So it is really my hope, as I said in my opening remarks, that we had 5 topics this year, that at some point over the course of the next year, we will get together on each of those topics and mark the work that was done and figure out how that work can be most relevant to policymaking. And that we will put in play a few other topics. There was a pretty robust system in place last year to select these topics. I assume we'll follow a similar protocol for the next year. And then every year we'll be doing some reckoning of the advances on topics we already put in play and putting new ones into play as scientific work evolves. This is enormously exciting. It feeds into policy immediately because day in and day out, OIRA is involved in evaluating the consequences of significant federal regulations. And the better we can do that, the better work we will do for the American people. So I can guarantee that if this work is done, it'll be put to good use, and it will put to good use right away. Huge thanks to the co-chairs of this venture, and to all of my colleagues at OSTP, CEA, and OIRA, and a special thanks to the researchers from universities who participated today, who are doing the work that will make our policymaking better. Thank you, and I look forward to the next iteration of Frontiers of Benefit Cost Analysis.